Hey y'all. Hey y'all, and welcome to my channel. On this page, I talk about technology, money, hockey, and sometimes trending news. If you're new here, welcome. And if you're returning, welcome back. I hope everyone is having a good spring right now, especially for my nurses. We are about to go into Nurses Week. Nurses Week celebrations have already started. I've begun seeing discounts from stores and different advertisements on social media, and then also on regular television and traditional. This is one of my favorite times of the year. Also, one of the busiest, like work wise and also family wise, which is why I've kept the content, especially around hockey and things, just kept those videos under 5 minutes. But this story, I have been actually following for the past several weeks. Let's see, we're the first week of May, but it's actually been developing over the past really few months. So I've been keeping my eye on it, and it is really interesting, especially considering, for those who have who are watching this listening from the future, over the past like 2 to 3 years, I have been talking about the impact of artificial intelligence on nursing practice. It has been top of mind for me since 2019, since 2020, since the pandemic. It's definitely been top of mind. I'm a registered nurse, for those who don't know, and I work in tech. I work in technology operations. My specialty is nursing informatics. But I don't work in a traditional nurse informatician role. I actually work in technology operations, deploying and managing new technologies, technical contract management, budgets, and things like that. So the evolution of artificial intelligence and its impact on nursing practice has been top of my mind since 2019, because this is the work that I do. Not everything my teams deploy and manage have artificial intelligence embedded in it, but I do work with nurses who do, and I do have colleagues who don't work where I work, who also manage technologies with artificial intelligence that impact nursing practice. So I have been seeing it, y'all. I do have a playlist. And I think one of the videos I did maybe a month and a half ago saying artificial intelligence will not replace nurses. But so this is why I say I have definitely been following this and this particular story over the past few weeks. I have been keeping my eye on and the feedback, because it's really interesting. Number one, we're going into Nurses Week. So happy Nurses Week to all of the nurses and people who work in clinical areas. And, I say on this page, when I say nurses, I'm not just talking about registered nurses. I'm also talking about licensed practical nurses. I'm talking about certified nursing assistants, nurse practitioners, okay, because all of those roles are important to the care of the patient. So happy Nurses Week. So some nurses are protesting AI, artificial intelligence. Why? Let's discuss. Okay, and then so thank you very much to ACD for in educational consultant, y'all. She has been doing lots of great interviews with different nursing professionals in different roles beyond the bedside, preparing and giving information. She just did a recent interview with another nurse content creator I follow, who has a nurse recruiting agency by the name of Brianna. So please check out ACD for educational consulting. She says they're anticipating another great broadcast. Keep going. Thank you. I appreciate that encouragement, because it is a very busy time between work and family. And she also shared us a comment. You have been preparing us for AI and healthcare for years. Thank you very much, because I definitely keep an eye on it. Not only in the work that my teams or the teams that I see people deploy, but just in general, because just like how we see artificial intelligence changing banking, changing how we shop for groceries, changing how we shop on Amazon, changing how we do food delivery, how you even scroll on social media. It's changing the trucking industry. Artificial intelligence has changed and is changing the trucking, the transportation industry. So if it's changing all of those other industries, why would it not impact and change the nursing profession? Okay. So, all right, I'm going to start with sharing my screen. I got a couple of items to get through. The first, I'm going to start with a video. So nurses out in California, part of the California Nurses Association. This one really caught my attention because this is not a, because I've done stories and seen like stories from nurse content creators like on TikTok, on YouTube, talking about social media. And that's fine, you know, if you're a nurse content creator with like 100,000, 500,000, a million followers. But when you have a state nurses association putting together a protest around artificial intelligence, that made me pay attention, because the State Nurses Association represents thousands of nurses across the state, okay? And they have not only the representation power of those professional nurses, but also the political leverage to advocate, like at the state and federal level, for nurses. So when I saw a State Nurses Association putting together a protest together against artificial intelligence, it definitely made me pause and like, okay, this is really big. Okay, so let me share my screen. Enough of the little background. Okay, so first I'm going to share a YouTube video to give a little bit of context. Hopefully the audio is sharing. I'll play maybe like a few seconds, and please let me know if you all can hear. Let me turn the audio all the way up. Okay, it is all the way up.
Are your doctors using artificial intelligence?
If someone, the two people who are here, thank you for being here. If you can hear the audio, can you just let me know in the chat? If no one is able to, I'll just go ahead and play. Hopefully you all can hear the audio. Okay, so this first video comes from NBC, okay, out in the Bay Area. And as I noted a few weeks ago, towards the end of April, the California Nurses Association staged a protest against Kaiser Permanente. Kaiser Permanente is one of the largest healthcare providers in the state of California. And I do have to add that I do believe California is a union state, okay? So that's also very important for context. So this first video I'm playing is only 24 seconds, and it comes from NBC News. And as always, I will be sure to leave a link to all references, articles, peer-reviewed journals that I share in the description box after the live, because I always want people to have the ability to research things for themselves and not just believe what I'm talking about and showing. Okay.
Are your doctors using artificial intelligence? Some nurses say yes, they are, and they're not happy about it. In San Francisco, nurses protested outside Kaiser Medical Center. They say Kaiser is using artificial intelligence, and that tech risks patient safety. Kaiser issued a statement that says AI tools are correct and unbiased, and they do not replace human assessment.
Now, the piece about AI being unbiased, okay, okay. I have some thoughts about that. But let's share a deeper article. Okay, let me present my, hey, Shar Willie, she's here. Thank you for being here. Thank you for giving me the feedback also on the audio. So let's get into a deeper article. Now, this article is from the National Nurses United. Okay, so that is a nurses union. But the National Nurses United Nurses Union is also associated in California with the California Nurses Association. Now, as I've said on here before, I follow a lot of nurses on social media, on LinkedIn, on YouTube, on Instagram, on TikTok. So I am in the nurses content creator algorithm and algorithms. And within that, I have seen nurses who are for nurses unions. I have seen nurses who are against nurses unions. I have seen content from nurse creators talking about what it's like to work at a hospital with a nursing union and how it is negative or positive for them. I've seen nurses on the fence about it. I'm just sharing that for context, okay? So National Nurses United, Nursing Union, California Nurses Association demand patient safeguards against artificial intelligence technology. So on Monday, April 22nd, so right around 2 weeks or so ago, hundreds of registered nurses and members of the California Nurses Association from across the state, it said will hold, they actually held the protest to highlight their patient safety concerns about AI technology and the hospital industry's rush. That made me pause to implement untested and unregulated AI. Now, as I was reading through this article and another article from Becker's that I'm going to share here in a moment, saying that it was untested and unregulated, I immediately popped into my head questions around governance and deployment and implementation. And I'll go into that, what I mean by that here in a moment. So the president, so someone says it's deeply troubling to see Kaiser promote itself as a leader in AI and healthcare when we know their use of these technologies come at the expense of patient care, all in the service of boosting profits. And I believe this person, she is the California Nurses Association president, which again, for non-nurses, a nurses association for a state hold a lot of leverage in terms of influence for nurses across the state, because nurses association, just like any other professional organization, like a doctors association or for dentists or for teachers, etc., and again, teachers unions, they have a lot of influence, both political and for their representative, the people that they represent. Nurses are all for tech that enhances our skills in the patient care experience. But what we are witnessing at our hospitals is the degradation and devaluation of our nursing practice through the use of these untested technologies. I was just curious, like, how do they know they're untested? And I'm not going against what National Nurses United and the California Nurses Association, what they said in their statement. I was just curious, like, how do they know if it's untested? Like, did Kaiser come out and say they have deployed these technologies without testing? Like, I'm just curious. I was like, where did that part about it being untested come from? And that was just me just curious. As patient advocates, we are obligated to speak out. We demand that workers and unions be involved at every step of the deployment of data-driven technologies and be empowered to decide whether AI and how AI is deployed in the workplace. Now, this I agree with. And I have talked about it's the piece where nurses being involved at every step of the deployment of data-driven technologies. Now, this sentence right here, this piece, I absolutely agree with, and I will tell you why. I have been on multiple implementation projects, right, deploying technologies. Now, I'm a registered nurse. I would never deploy technology, for example, say if we're deploying a new piece of technology in the CT ICU. I would never go into a clinical area to deploy new technology without having nurse experts in that specialty of nursing at the table. And not just at the table, those level of expert in that specialty of nursing needs to be when you're looking at, before you even buy anything, when you're vetting vendors, when you're talking with vendors, when you're talking through operational workflows, when you're talking through the testing, when you're talking through the deployment, when you're talking through the ongoing involvement. Now, y'all, I've worked in tech for 20 years as a registered nurse, and I have been at the beginning of projects. And again, I work in technology operations. Okay, so the work I do is a little bit different, but I've been in the beginning of projects, and I'll go into a project meeting or see like the list, when you're the early, and there's no nurses. And I'm a nurse, but again, the role and the work that I do, my team does is different. And having to advocate or seeing some of my colleagues having to advocate to make sure there's a nurse from that unit, that department, that specialty of nursing. I would never deploy technology in the area without nurses at the table. It just won't work. It won't work in terms of adoption. It won't work in terms of adaptation. It won't adapting. It will not work in terms of optimizing without the nurse's voice being valued and being considered. It just won't work. So that piece I agree with, and I'm actually quite passionate about, as you all can tell. So the action coincides with the start of Kaiser Permanente's International Integrated Care Experience Conference. See why they were protesting, which is Kaiser's, it says, is one of the earliest adopters of AI technology. Other hospital systems are also busy implementing similar AI pilots and programs. Y'all, I read an article, maybe about, no, not an article. I was at a networking event and talking with some nurses there, and they were telling me, and I believe, don't hold me to it, but what is that big hospital, for-profit hospital, for-profit organization that has like hospitals all over the place. They're big in Florida. Oh my goodness, it just went out of my brain. But they have built or are building a hospital of the future where AI and technology, it's like an innovation hospital that they are building, and technology is like everywhere. I actually saw an open position that they were looking for. This is months ago, but they were looking to bring in some nurses who had like technology experience to help build out the innovation hospital. Oh my God. They're also in Tennessee. Oh, they're huge for profit. It'll come to me. Anyway, so yeah, hospitals, health systems, hospitals are deploying AI pilots. They're deploying pilots around integrating AI in the beds, in the IV pumps, in the scheduling system, like scheduling nurses, also like in the dietary system, in environmental services, for like the decreasing the burden of documentation. Just a lot. Pilots are just going on. And then another nurse talks about, it says nursing unions will never stop fighting for patient care. Okay, so enough on that. I did want to share here. We did got some feedback. Yes, AI definitely has some biases, just as the rest of society. I agree. So when I saw in that article, it says that from KP Kaiser, it said that AI is unbiased, and I was like, how can they just say that? I just found it interesting to say it is like totally unbiased, right? Because some biases are inherent, and from what I understand, some programmers have to make sure when they are writing these algorithms that they are not writing their own biases in the algorithm, but sometimes they do make it in there. So yeah, I agree with that. And then human-centered design is essential in healthcare. It must be nursing-centered. Amen. You just cannot deploy nurses technology for nurses or providers or any other professionals without including experts from those areas. So I found an interesting article from Becker's, right, talking about Kaiser Permanente about AI from earlier this year. And I really wondered if, now this is from February, and mind you, the nurses protested AI. It happened towards the end of April. But some researchers at Kaiser, okay, which is, where these nurses were protesting, found they did some research, and they found that AI scribes fall short, again, per this study. And it says scribes show promise in reducing the EHR burden of clinicians, but their accuracy and clarity still leave much to be desired. So these researchers surveyed 3,400 physicians who have used AI scribes, which means like transcribing appointments via a smartphone microphone, right? So either talking into the microphone and then the AI is doing the writing for you. And they also, in that research, include over 300,000 patient encounters. And they found an overall favorable response from the providers. However, clinicians still have to edit the notes for accuracy and relevance. And of course, you would never want to just like when I use Chat GPT all the time. I use it several times a week for just different things. But you would never take what you put into the AI and just run with it. You always have to have that level of review. It's not going to be 100%. There was a book I read last year and did a review, and it was on like GPT, I think 2 and 3, but it was talking about there will always have to be a provider, no matter how sophisticated the AI scribe is, you will always have to have a clinician edit the notes for accuracy and relevancy. It says 35 AI generated transcripts scored an average of 48 out of 50 in 10 quality metrics, but it's not a replacement for clinicians. And this is why I said in a video I did maybe 2 months ago, artificial intelligence will not replace nurses. It will not replace clinicians. I just don't ever see it happening, because the nurses, and again, when I say clinicians, in this case, I'm talking about nurses, AI can never be totally empathetic like a human nurse can. It can convey empathy, but it's not empathetic because it's not a sentient being, okay? AI cannot be intuitive in the same way as a human being can be intuitive. If you talk with a nurse with some experience under her belt, his belt, their belt, there are just some things when you care for a patient based on different indicators intuitively, you may be like, oh, I think this patient might be close to a code, or what's the step before a code, right? Just intuitive. Or you may start seeing things, you're like, oh, I think this patient might be going septic, right? That just intuitiveness that the AI can't pick up on, or visual things that you see as a nurse, right? You can put all the information into the computer or an algorithm, but still laying hands on the patient, doing a physical assessment, seeing, smelling, right? AI can't smell like the nurse in the room is changing a wound dressing, right? You can, I know there was a nurse I met at a conference who has created an AI to help with wound assessment, okay, using camera technology. But that AI camera technology cannot smell, right? So the nurse in the room, as they're doing the dressing change, they may smell things that the AI can't pick up on. So it would never be a replacement, right? And then the researchers acknowledge that the AI can produce inconsistencies that require physicians' review and editing to ensure that they remain aligned with the physician-patient relationship, and recommend a better EHR integration and workflow personalization options. Okay, I have 1 or 2 more things to share, and then I will wrap up. Okay, let's see. Let me do a quick time check. Okay, good. So we are right at 20 minutes. So we are running good on time. I wanted to try to keep this below 35 minutes. Yes, Charwillie is correct. Programmed by a human equals biases. Again, I agree. So again, when I read that statement from Kaiser, I don't have any vested interest in being for or against Kaiser, but for them to just come out and say the AI has no bias, I just thought it was interesting for them to put that, to just put that in writing like that. ACD for instance, I don't mind the protest from nurses for ethical use of AI, but to push back, but not upskill to learn how to use AI is wow. Exactly. We have, as nurses, you have to always be upskilling. You have to. And when I tell y'all, and I'm just one of thousands of nurses who work in technology, but when I say the technology is changing so rapidly, I have seen where not where I work, but colleagues where they have purchased technology and spent a lot of money on technology, deployed it, and within a year, the technology is obsolete, and they're already looking to find something else to replace it, right? And you haven't even at that point gotten your return on investment yet. Technology is changing, so I have never seen, and I've seen it since 2018, 2019. It's just changing so fast. It's just so rapidly, and nurses have to upskill. Whatever, even if you're not in technology, but if you're at a bedside position, ambulatory clinic, if you work in the perioperative arena, if you work in aesthetics, right? If you work in home healthcare, you have to continue. I upskill, right? And I don't, even for my job now, I don't even have to have a nursing license because I work in technology operations, but I keep my nursing license active with my clinical education and my ongoing learning, because you just never know. You have to continuously upskill, and you have to know what's going on in your professional practice. And again, it doesn't just apply to nurses, but it's also for teachers, it's also for transportation, banking. I use Copilot all the time. I definitely use Copilot. Man, let me tell you, it is a game changer in so many ways. I use it for work, I use it for family, I use it just really has enhanced the day, like just the day to day. And I even know that I'm not using it as much as I use it. I know I'm not using it to its full potential. AI would need to be trained on clinical indicators to predict the diagnosis. That is correct. Okay, one more. Oh, so the San Francisco Chronicle, this next video is only 18 seconds long. So the San Francisco Chronicle, and I'll just play it. The San Francisco Chronicle went out to the protest where the nurses were protesting the AI, and I'll just play that because it's less than 20 seconds long. Very short. Oh! 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 So these nurses are protesting, but I don't think these organizations are going to stop using AI. For them to be protesting, I just wonder how transparent Kaiser was with the deployment of this technology. And it goes back to what I said in the beginning. I wonder if they had nurses at the table. I wonder if they had any type of governance in place, right? Because governance when you have governance structure in place, it helps with the understanding of how the technologies will impact and change people's workflows. There was one more article from National Nurses United about what is AI, key examples of, sorry, let me share my screen. Sorry about that, y'all. Here we go. I think this is the right one. No, that's the one I already shared. My apologies. I wanted to share the one from the California Nurses Association where this protest took place, where they talked about the AI's impact on nursing and healthcare. All that we've talked about on this channel, all that many other nurse content creators, like Bree has talked about on her channel, like ACD4N Educational Consultant has talked about on her channel. There are nurses on TikTok have talked about it. So some key examples of AI nursing, again, is staffing and scheduling and why it's problematic around patient acuity measurements, depending on nurses charting in real time, clinical prediction, which is like clinical predictive models, meaning like using different biometric and monitoring to see like if a patient is going to go septic or if a patient is going to have a code blue. And they talk about why it's problematic. AI used in remote patient monitoring, and also automated charting and nursing care plans. And I said earlier, and I say it again, the California Nurses Association is affiliated with a nurses union. And I'm not for or against nurses union. I've never worked in an organization that had a nurses union, and I've seen nurses in favor of and against. So, but I've just pointed out that this article is from a nurses union because, of course, it's going to be slanted in a certain way. Okay. So the last article, I found an article from the New England Journal of Medicine that I won't cover, but it is from February of this year. You all know I love peer-reviewed journals. I'm all in favor of peer-reviewed journals peer-reviewed journals when it comes to research, because to me, they provide an extra level of credibility about the articles and data and research that they present. So I will put it in the description, but the article from the New England Journal of Medicine talks about research on Ambient artificial intelligence scribes to alleviate the burden of clinical documentation. And Ambient artificial intelligence is like a technology. It could be used in a way you may have a speaker in a patient room, a speaker like an audio, something that hears in a patient room, and it's just there. You don't see it, you don't see it, you can't smell it, etc. But you just have a natural conversation with your patient, like you're doing an assessment, you're changing a dressing, and you're talking out loud what you're seeing, and the AI also hears what your patient is telling you. And then that Ambient artificial intelligence scribe will then hear the conversation and write your nursing assessment or write your nurse's note and things like that. So some researchers did some research on the effectiveness and Ambient artificial intelligence. So I'll leave that. So if folks who are interested want to read about that research, you can. And the last article is on nurses having a deep distrust of AI, but training and transparency. This is why I keep going: governance, transparency. If you all, for the three of you all who are listening, thank you for being here. If you don't take away anything, and just remember, nurses should always have a seat at the table. There should never be technology deployed where nurses don't have a voice and their input is not continuously valid, and they're made to feel welcome at the table. Their feedback is considered and implemented and refined because they have the knowledge, right? They have the knowledge, they have the experience, they have the direct care experience. So that to me is so important, which is why I keep mentioning it over and over, that governance piece and that nurse at the table. Trust me, I have seen technology deployed where there are no nurses at the table. And let me tell you, nurses are very smart. They can make or break your project. So this article from Health IT News, this is a very new article, just came out on Monday, April 30th. It says nurses have a deep distrust of AI, but transparency in training, going back to that governance and that seat at the table, could help. And then it talks about the protest that the California Nurses Association organized in San Francisco against Kaiser. For those who are not in healthcare, Kaiser is one of the largest healthcare providers in the state of California, and the California Nurses Association represents thousands of nurses across that state. So for a nurses association to pose a protest against one of the largest healthcare providers in the state, it's really big, which is why it made me pay attention. Okay, so the article talks about why nurses have a deep distrust, ways that it is used. It says nurses want to say in AI deployments, again, that piece about having a seat at the table. And it just repeats what the president of the Nurses Association talked about. Here we go. They also released the FAQs as well. Let's see. Here we go. It says that Kaiser posted an article on their website last month and said that the health system is let me highlight. Sorry about that. It's highly focused on developing responsible AI in healthcare, and that it values the need for key guardrails to protect patient safety. For those who don't know, a guardrail in AI is exactly what you would imagine a guardrail would be. If you think about like on a highway, you have the guardrails on the side of the highway. So the guardrails keep you from going, like over a ledge or over the edge in places that you should not. And it's just like you can put guardrails within your technology. So for example, a doctor cannot overprescribe on a medication. And it says that Kaiser's vice president of artificial intelligence and emerging technology advised on considerations for policymaking. While he did that, he didn't provide insight into the involvement of staff feedback. A seat at the table. He didn't say, did these nurses have a seat at the table? Did they understand what the organization was doing around technologies? I'm just assuming, I'm just a person on the internet reading these articles, but I'm just assuming for a whole state nurses association to stand up a protest as big as they did, again, that's like Goliath going against Goliath. I have a feeling nurses did not have a seat at the table. And again, I'm just assuming. I honestly do not know. But it says they didn't provide insight into the involvement of staff feedback in testing and validating the accuracy of AI tools and continuous monitoring of outcomes to ensure it is working as intended. That goes back to the transparency, okay? And just like, what are you doing? Nurses are smart, right? For those who have interest, they want to know what's going on. Like if I'm a nurse at the bedside and I hear the hospital I'm working at is deploying, maybe doing a pilot on a step down unit for some AI that's going to help reduce the burden of nursing documentation, I would want to know, even if the pilot isn't on my unit, right? So what was done around the communication of saying, hey, we're testing out this AI, this is how it's performing, this is what the nurses are telling us, etc. And then the article goes on a little bit more, and it says, I'll just speak to this last thing and then I'll wrap up. It says nurses respondents' top 5 concerns about using AI in healthcare were 1, lack of empathy and patient connection. That's why I said AI will never replace nurses. A robot, I know hospitals are using robots and testing robots to help nurses, but the robots can never have empathy. They can never do the patient connection. It can do some. Job replacement, data security, regulation of emerging technologies, and upskilling. Who was that who said earlier about upskilling? It was ACD4N was talking about upskilling. The upskilling is so important, y'all. Nurses you are the real scientists doing the work, laying the hands and healing patients. I agree. But that upskilling, y'all, I think some people just underestimate just how powerful that go and how far it could take you. Okay, let me go back to this article so I can wrap up. It did talk about, so Florida Atlantic University launched 2 new combined programs in nursing and artificial intelligence and biomedical engineering. Oh, that's an interesting one. I've never met a nurse who's a biomedical engineer. Now, I've met a nurse who is she's a mechanical. She has her PhD in mechanical engineering. She worked in the ICU, and then she went back and got her PhD. I think it's mechanical engineering. But anyway, so Florida Atlantic University has combined programs in nursing and AI and biomedical engineering. I think Duke University Duke School of Nursing also has a program around artificial intelligence. And who is his name? I think his name is Michael Carey. If y'all just bear with me, he is someone I have been paying attention to in terms of what he's doing over at Duke School of Nursing. Yes. Let me share. Okay, let's share this article real quick, and I'll share what I've been a nurse scientist in artificial intelligence at Duke School of Nursing that I have been following the work that he's doing around artificial intelligence and nursing and the conferences and information sharing that he's been doing through various forums. I'm going to share this article, and then just for Dr. Carey, someone who has definitely caught my attention in terms of the work that he is doing. So this is Michael Carey. He is a registered nurse at Duke School of Nursing, but he also works with Duke AI Health. He is the Elizabeth Clipp Chair of Nursing and has been appointed as the AI Health Equity Scholar. So his work, it says it leverages biomedical and healthcare data sets and innovative data science approaches in order to identify risk factors to contribute to functional decline and rehospitalization among older adults. But he is doing a lot for those who are maybe have some further interest. And I have no vested interest in the Duke School of Nursing, Duke AI Health. It's just anytime that I see minorities, women in different types of roles, I always like to follow like the articles they release if they, speaking at conferences and things. And Dr. Carey, they actually did an AI nursing AI conference at the Duke School of Nursing, I think a few months ago. So it's interesting. Okay, that's all I had tonight, y'all. Okay, definitely something to pay attention to. Nurses protesting artificial intelligence. I think because this is the first time that I have seen nurses protesting it, it's going to be interesting to watch what's going to happen over the next 6 months. And the reason why I said next 6 months and not next year, next 2 years again, because the technology is evolving and changing so rapidly. And it will be interesting to see if other state nurses associations will start following suit, specifically around AI and its integration into nursing practice. We got one last comment. The nurses are probably concerned that AI is going to be used to monitor nurses' productivity. It might. It very well might, right? Because we already have technology that monitors how long a nurse stays in a patient room. How often did the nurse go into the patient room? How often did the patient go? How often did the patient call the nurse to go into the room? Yeah, it may, it probably is, and I just don't know. So yeah, I could definitely see that concern there. Nurse engineers are definitely becoming more of a thing. That nurse I was mentioning earlier works for the Library of Congress. The one who's I think she's a mechanical engineer. It's going to egg me until I figure out. But yes, nurse engineers, because y'all know one thing, nurses are very smart. Nurses are innovators. Even if they are not innovating in technology, I have seen so many innovations come from nurses at the bedside. I always feel like, who was it? It wasn't Florence Nightingale. Was it Florence Nightingale? Or was it the Jamaican nurse who said that nurses are the original data scientists? One of the nurse innovators, the founders of nursing, not founders of nursing, but one of the historical nursing figures said that nurses are the original data scientists. I think it may have been Florence Nightingale, but because, we're constantly assessing our patients, taking in data and thinking about not only the care that we're providing right now, but the care that the patient may need, 6 hours from now, etc. So something to pay attention to, y'all. This is interesting, but I'm definitely going to keep my eye on it, y'all. Y'all know, because I work in tech, very interested in it. I'm going to continue to follow it. If anything else comes out, or if I see other state nurses associations following suit, or if I see something happening at the federal level, something probably is, and I probably just haven't come across it yet, I'll definitely try to share the updates. But it's going to be interesting to see what the California Nurses Association is going to do next. Because I honestly, y'all, I don't think they're done. Because this is to speak out so vocally against one of the largest healthcare providers in one of the largest states, that is so significant as a state nurses association, y'all. I just can't underscore how big it is. Okay, thank you everyone who tuned in tonight, who stayed to the end. Thank you everybody for your comments. I love when you all engage with me. I appreciate people who send emails and messages. Also, it encourages me to keep going when you all like the video, when you share comments, when someone said, hey, someone told me to check out your YouTube channel and you talk about these things. I really do appreciate it, y'all. I really do. If you think this content was helpful, share it with a friend. If there's something that you come across that you think I would find interesting, please do share it with me, because I don't have eyes everywhere. So I always love taking in new information. So I appreciate the community here that we have on this channel, and I appreciate that y'all have kept it a respectable space. Okay, and I hope everyone has a good evening, and I will talk to y'all later. Bye, y'all.